Welcome to the Repro Files, where infertility meets injustice and nothing is off limits.
We're two nurses. We're certified reproductive health advocates, and we're here to tell you everything they didn't.
From the broken systems to the heartbreak left behind, we're here to connect the facts, the policies, and the pain.
Because silence isn't safety, and we're done being quiet.
This is the Repro Files.
Infertility, injustice, and all things nobody warned you about.
Anne-Marie, we did it. We're actually here. This is so exciting. It's the first ever episode of the Repro Files. So if you found us, whether you did it on purpose or by accident, we're really excited you're here. You're totally our kind of people.
You're just wondering why two fertility nurses on a podcast talking about politics, healthcare, injustice, and Billie Jean, but we'll get to that.
Oh, fair enough. We will get to that. That's a fair question. But
yeah, I mean, let's just start with how we got here, because it really wasn't a straight line for either one of us. So, all right. So listen, here I apparently, when I was in the first grade, apparently was like told my mom I wanted to be a nurse because she put it in my little book, that what do you want to do when you grow
your
up?
memories book?
Yes, and I don't remember that at all, because I don't remember saying that ever. But anyway, I do remember though when I was in the 5th and 6th grade, I wanted to be a senator, and I was trying to figure out like why did I want to become a senator, and I guess because that was the mid '80s, and I'm gonna date myself, but Geraldine Ferraro had just been nominated as the first female vice president candidate. I guess that made a big impression on me, and
Yeah.
I thought, hey, maybe my country can't handle me, but my state can handle me.
That's so funny because seriously, very similar story. I didn't really grow up dreaming of becoming a nurse, though the medical field was always kind of somewhere out there. Um, but I also had a penchant for politics early on. I remember meeting Hillary Clinton when I was a 16-year-old and just being enamored with the idea of public service. And I have a picture of her and I that still is on my dad's wall, and it says "future senator" and "senator" on it. So the fact that we both want to be senators as children is hilariously nerdy.
Yeah, I know.
But I mean, I guess I dreamt of change, right? Like of shaking
Mhm.
things up, and doing something different. But it was still it was a circuitous way kind of around it. I didn't go about it in the most direct manner, right?
Yeah, same. Yeah, I mean,
Yeah.
I went to college the first time around, and
Oh,
I got an
geez.
anthropology I got an anthropology degree with a minor in classical studies. So
That
I
sounds like
mean that
sets you up for
yeah.
all the jobs
Oh
or none
yeah, and
or none at all.
us liberal arts people can find jobs anywhere.
Well, you know
We just
what?
got to do it.
That's right. That's right. But it probably cracked your world open, right? Because I know for me, I also got a liberal arts undergraduate education.
Mhm.
And for me, kind of that same thing, it sort of cracked things open a little bit in terms of breaking beyond the things that and the constructs that I had been taught growing up, and allowed me to just like really think outside of that.
Absolutely. And it just introduced me to I mean, I hate to say the cliche, a whole new world, but it really did open up a whole new world to
Yeah.
me. So, I think that's where I started feeling like, wow, I have a voice. And yeah, so that's kind of like where I kind of ended up. I really loved it. I loved learning about new cultures. Um, then after I graduated, I went to corporate life and hated it. So I did that for
Shocker. Me
I did that for
too.
years. Yeah, I did that for years, and that was no good. So then I decided, hey, I'm gonna go back to nursing school.
Oh my God. I always, every time we share our like stories of how we got into nursing, it's always surprising how similar they are because for me as well, my first career was not nursing. I got my undergraduate degree in philosophy and psychology. So, like you, it's broad, but it's also like, well, what do you actually do with that degree? And meanwhile, I was living through a lifetime of really mysterious pain and symptoms that nobody could really understand. And I bounced from doctor to doctor for years before part of my going to nursing school. I look back now, I didn't know it then, but looking back, part of my why for going to nursing school was to sort of crack my own code of chronic illness. There's so many people that live in this country with chronic invisible illnesses that because doctors are so egotistical often and don't they're not open to saying, I don't know, but I'll help you find out. And so instead, it was a lot of gaslighting and a lot of like, this is in your head. And
Mhm.
so, I mean, I went through every medical system, not every, but a number of the very big medical systems in the country before I put my case sort of, I said, well, if I was a resident and I needed to get an attending to really understand this case, how would I do it? What would that S bar look like? Right? Like in nursing, that for those of you watching who don't know, nurses have all these, fancy acronyms, and one of them is
Okay.
the S bar, which is a way to routinely or systematically give a report from one nurse to the next or one provider to the next. And it's what's the situation, what's the background, how do you assess it, and what do you recommend? And so I put my own case into that, and I mean, by the time I didn't get diagnosed till I was 37, but I mean, I was collecting diagnoses like it was merit badges. And none of them changed the years of being disbelieved, right?
Yeah. I think that your story follows a lot of different nurses go into the nursing field because of their own, health journey, or
Yeah.
someone that they love that went through a health journey that they were like, they wanted to change the system, right? You went in there because you wanted to help people, but you also wanted to be like, hey, I want to be listened to. And that's why we became nurses, is because we
Yeah.
wanted to help people and help them understand and educate. And that's important, to us. So yeah, I mean, I did my nursing thing. And what
Where'd
did
you
I do?
start in nursing?
Oh my God. I did the normal thing. I did the med
The med
surge
surge?
like I was
Okay.
supposed to, and I hated it.
Say more.
So,
Why'd you
yeah.
hate it? I have a feeling
Oh,
I know because I started in step down ICU,
yeah.
like I was supposed to, right? But yeah,
Absolutely. It's not the patients. It
no.
Yeah, the work is hard. 12-hour shifts were hard for me. I don't like working 12 hours without going to the bathroom or eating or anything like that, or drinking water. So that was hard. But it was more of like the system. It was more of the dysfunction, the hospital, how it's run. It's just like it doesn't lead to like to success. It's kind of setting you up for failure in a way.
Yeah.
And so of course, I was burnt out, and I was crying in the parking lot every morning, and I was crying in the parking lot every night. So I was like, I got to
Oh,
get out of this. And and I had to find something new. I found an ad for a fertility nurse, and I was like, what is this? And so I went through, as you know, the interview process is quite intense. It took a couple of different interviews for me to get through. I got hired. I started, and oh my God. I found my jam. I found my niche. Like this is it.
yeah.
This is my niche. I
Found your
want it.
thing.
I felt hard. I
Yeah.
found my thing. It was, helping, supporting, educating, and I could practice the type of nursing that I wanted to practice and not be subjected to, you know, the shenanigans at the
Yeah.
hospital.
Those faulty systems. Yeah. You're so right about that because it's pretty, you know, both of us now having fast forward, right? We're in pretty senior level clinical operations and clinical, specialty realms, but it takes a long time to get there. And I remember my route did this step down ICU thing. I remember all the same things you talked about. I mean, crying on the way to work, crying at lunchtime, if you even got a lunch. I mean, I can remember we wore these like communication things that, like it'd be like, someone's calling you, and you couldn't even go to the bathroom without someone being like, where are you? We need you. And I can remember peeling my compression hose and my shoes off at night, just like my entire body was throbbing.
Yeah.
And I still would feel at the end of the day like I had dropped a lot of balls. And like you said, it's not the patient's fault, but it's the systems that nurses are put in. I mean, I can remember a particular shift on med surg, step down ICU. we usually have like 5 patients, 4 to 5 patients. And I had essentially like 5 extremely acute patients, one of whom was having a dissecting aortic aneurysm. I got report from the night shift nurse that this young guy, mid early 30s actually, had come in with chest pain. And they were thinking maybe he had a heart attack. His cardiac enzymes weren't elevated, so it was kind of mysterious. But the night nurse reported to me he was still having chest pain. He was still having chest pain. And I'm like, I just don't feel good about this. Have we done an echo? Like, what's going on with this guy? So I called the cardiologist. I'm like, I insist that you come like right now, and they tell you in nursing school that there will be times where you will have to
Mhm.
tell the doctor, I need you to come here right now. And that
Mhm.
was one of those moments in long, TLDR, the guy had a dissecting aortic aneurysm, which for those of you non-medical people, that's nearly always fatal.
Bad.
You have a
Bad.
big blood vessel in your trunk, called your aorta, your abdominal aorta, and if it breaks open, it's usually fatal. And
Yeah.
and I can remember telling like my supervisor, this doesn't feel safe because I've got this guy who's essentially now a full ICU one-to-one patient, but I've got somebody
Mhm.
on an insulin drip. I've also got somebody on a cardiac drip, and I've got a patient getting blood. This is not a safe assignment. And I was
No.
told, maybe you should manage your time better.
Oh,
And that was
yeah.
the system, right? That was the system. That was the process. But when I ended up stepping away from bedside nursing because my body couldn't hold, it just couldn't, with my illnesses, I have Ehlers-Danlos syndrome, which is the genetic connective tissue disease that causes lots of joint laxity, which translates to like lots of musculoskeletal pain and things like that, just from like loose ligaments. So you can imagine the hard work of bedside nursing just took its toll. And I saw this ad for, like, did you say you saw an ad too? I saw an ad
Yeah.
for like a
Yeah.
local super small fertility clinic was hiring a nurse. And I was like, this sounds awesome. And I can remember the driving home from that job crying. And I was like, crud. I thought this was what I was getting away from. Um, and ultimately, it's hard. It's not anything we learned in school, really. It was like 5 minutes of one lecture of the entire time we
Mhm.
were in school, and it was
Oh, yeah.
learning a whole new language. And then too, people think fertility is just happy rainbows and pregnancy tests, but it's really, really deep work,
Yeah.
and it's trying.
It
It's
is.
trying.
It's like when when things go well, it's happy and we're all happy. When things don't go well, it's sad and it's hard.
Devastating.
And it's like, the patients, they are like you said, devastated. But as nurses, I always felt that with them. They're my patients. I feel like they're mine, and I want
Yeah.
to, I wish I could just make that pain go away for them, that emotional, that mental anguish that they're going through. And so it isn't always happy, and the happy does sometimes come later. It just takes a long time to get
Yeah.
there. And that just, coming back to a system failure, doing an IVF cycle is crazy, right? I
It
mean, the amount
is.
of money, patience, time, all of these, it's crazy. And that's another level of where we also took our fertility nursing, is that we both saw that our patients were unable to move forward, not just because, oh, we can't do any more IVF or we can't do this. They ran out of money and they
Oh,
ran out of opportunities, or they didn't have access and they moved to an area and they would have to drive 3 hours to get to a fertility clinic. That is just craziness to me. And that's kind of like where my Gen X, persona comes out and goes, fair is fair. I told you I was going to get Billie Jean into this. Billie Jean, the legend of Billie Jean, not Billie Jean by Michael Jackson. The
thank,
movie. Fair is
thank,
fair.
thank you for clarifying that because I think folks, I was thinking Billie Jean, Michael Jackson from the top. So thank you for clarifying. Hopefully we'll hear more.
Girl. Yeah.
But no, back to what you were saying about people walking away. Um, and walking away isn't even the right word. It's just they're getting shut out of it.
Yeah.
Because the system fails. They run out of money. They run out of patience. They run out of time. They run out
Hmm.
of all three. I mean, I could tell you countless stories of patients over the years who mortgaged their home, who
Hmm.
borrowed, 30 grand from parents. I'll never
Hmm.
forget a patient I had once, young PCOS patient. PCOS patients in IVF are they're kind of an enigma. It can go really well or really poorly. And
Mhm.
this woman was like in her mid 20s, so we had that on our side.
Yeah.
But she was flying to do treatment in New York from California. So if you can even imagine that in and of itself, right? All of a sudden you're having to give yourself injections, you're having to get vaginal ultrasounds every other day. I mean, it's a
Mhm.
lot. And um, the field exists in a pretty gray zone because there's not a lot of regulation, right? And this is where you were talking about both of us really experience this.
Mhm.
And then we both said, what do we do about this? And that's where we actually met in um, a program that was specifically designed to prepare reproductive medicine experts like ourselves to advocate on a policy level for these things because patients paying out of pocket, policies being all over the place, no standardization, right? These are all things um, that don't need to be that way. But because IVF is young, right? Our friend Elizabeth Carr, the first IVF baby in the US, Louise Brown just had her birthday. I mean, IVF is not that old. So when you
Mm-mm.
consider, one thing I saw really, really early on was, like I said, I started out at a clinic, small clinic, but very expensive clinic. And I really, really, really quickly picked up on the fact that the majority of the patients coming there were super wealthy. So this
Mhm.
was just to paint the picture. I started this job like in June. So June in Arizona. And this clinic was on the second story. And the doctor was probably one of the first reproductive endocrinologists in this area. So like OG, right? And he believed that the OR, where we do like egg retrieval, embryo transfer, had to be set at body temperature. So the OR was set at like 90 degrees in
Yeah.
Arizona. So we would wear
That ain't
ice
gonna
vests,
fly with me.
but again, no, very little regulation, very new
Mhm.
field. Everybody did it their own way, right? And I was really lucky because one of the nurses at that clinic was brilliant, and she did such a phenomenal job teaching me like the nuts and bolts of fertility.
Mhm.
But I remembered watching people's reaction when they were told how much the cycle would cost.
Mhm.
And it
Oh
broke
yeah.
my heart because in my mind, um, your zip code, your mean household income, these are not things that should stand between you and becoming a parent, right?
Absolutely. I mean, I would sit there and I watch. It literally was like this. It was like their face. You tell
Yeah.
them the price, and the face would just go from hope
Hopeful to
to like
heartbreak.
okay, well, I'm walking out of here, and that was hard. I mean, my start of my fertility life was a little different than yours. You started small. I actually started at one of the larger clinics in the
Mm,
country. So my training, they had like an education department, and I went through all of that, and I got to do. It's very departmentalized, so
mm,
I was able to go down and watch embryology, which was fascinating. I wish I
right?
had better coordination. I would love to be an embryologist, but I do not have coordination, so I am not. Um, but yeah, I mean, I went through all that training, and it was. I also came from a mandated state, so I came from a state in New Jersey at the time where I lived. It was a mandated state, so people had access. They had
Yeah.
the resources. They had insurance coverage, even if it was just a little bit. That little bit helped.
Yeah.
And then I came down to Florida, which is where I am now, and I helped open a clinic. And Florida is a non mandated state. So I saw a lot of
Wow.
differences of my patients when I started the clinic down here. And like you, I was just seeing like very wealthy patients being able to afford coming in. But I think we discussed this one time about how like people would take part-time jobs at Starbucks or at
Yeah.
Amazon and companies that do provide it, but they're also working their full-time jobs as teachers or what have you,
Yeah.
just to afford things. And it wasn't just that. It was, like you said, the crowdfunding. It was, I had patients make candles and sell them on Etsy and,
Right.
things like that. It's like, why should my patients up in New Jersey have the option to be able to just come into a clinic and have their insurance, whereas down
Treat it
here,
like the medical procedure that it
yes, because infertility is
is a disease.
is a disease.
But can you
And
believe that we just got that designation that infertility is a disease? That just happened
I know that that is brand
2
new
or
news.
3 years ago. It was not
Yeah,
that long ago,
it
right?
wasn't.
So to think
It was
about,
crazy.
it, it shouldn't take that kind of desperation to do something as basic as starting a family.
Mm-hmm.
And I had so after my time doing like a regular bedside nursing, before I went on to fertility, I did move to labor and delivery because when I was in nursing school, the first couple blocks, I'd say, well, what do you want? What kind of nurse you want to be? Anything but OB is what I always said.
Yeah.
Anything but women's health. Then I did
Yeah.
my OB rotation and I was like, I want to do OB. So it's so funny how you think you know what you might want to do. But
Yeah.
in any
I was
case,
like, no, I don't want to do. Even after my OB rotation, I said no, no
be like, no thanks,
vaginas.
no thanks, no vaginas. I'm done. Yeah, no. So I was like in love with it once I did the rotation. And so I did do labor and delivery nursing for a number of years and found myself gravitating for what that's maybe the wrong word, but um, finding myself excelling at helping hold space when there was pregnancy grief, whether that was um, a neonatal loss or a fetal demise, whatever it was. I quickly recognized that these moms had this very brief window of time to make a memory, I guess, or to like to come into a hospital pregnant and to leave without a baby is one of life's most unfair shakes. And that's where it really shifted for me because the cruelty of that, of seeing, a mom clutch her angel baby and know that she'll all the hopes and dreams that she had for that baby will never exist. And then moving into infertility and seeing that same thing there, right? You have this idea of from like the moment you find out you're pregnant, even when you do IVF, you have embryos, right? And you start really just picturing what that life might look like, right? So that's where
Yeah.
it shifted for me from truly being a nurse to being an advocate, right? And I'm the kind of like I'm like you, fair is fair, okay? That's not
Mhm.
no, we're not doing that. That's not fair. So I never had a problem standing up for patients, advocating for patients. Like I said, like I knew that patient was really sick, and so I got out there and advocated for him. But this was different because
Mhm.
now when we're growing up as young people, we I think most of us picture what our future family will look like. And never, ever in that dreaming did we see $30,000 price tags,
Yeah.
3-hour drives,
Yeah.
leaving with nothing, becoming,
Mhm.
bankrupt. None of that was a part of it. And none of that should be a part of it.
Nope, absolutely not. And for me, it took me a little bit longer than you to become an advocate. I was just doing my thing, running my clinic,
Yeah.
got burned out a little bit. I left clinic life, and then we joined this program. That's how we met,
Yeah.
through ASRM, and I basically learned advocacy through Brian, but also through Elizabeth, because when we went to Washington the first time, I don't know if you remember this, but you sat next to me when we were at the floor, right? When we were on the floor for the bill, the
The right to
assisted IVF,
IVF, the Senate bill,
right to
right?
IVF. Yeah, Senate bill. So we were in the Senate, and they like take everything from you. They take your phone from you. You can't go onto the floor with, or in the gallery, you can't take your phone with you. You can't even wear a watch. I was the only one that had a regular watch on, so everybody was asking me what type it was because I'm the only one that wears
Classic
watches.
nurse. Heck
Yeah,
yeah.
everybody had their iPhone
Whatever.
watches. Yeah.
Yeah. Apple Watch.
and and so I was like the watch person. Every what time
What
is
time
it?
is
What
it? What
time
time
is
is it?
it? But Elizabeth's over there sitting next to me going, "Oh my god, that's so and so." And I'm like, "Who's that?" And she's like, "It's so and so." And I'm like, oh, who's that? And she knew everybody on the floor. It was like fangirl. She knew everybody. And it was like, it was as if I had never been to a baseball game and she knew every single baseball player out there and she could name like what they did and what
It was
position they
so funny
played.
too
And
because
yeah,
I'm a total politics nerd. I always have
right.
been. And so I remember that being so funny because I hopefully Capitol Police will not come for me, but I did sneak Tic Tacs into my white coat
Ooh.
because
Oh, you in
I know
trouble.
I was a total rebel. But I remember like they took everything away. They let us wear white coats though, and I'm like,
Hmm.
I'm gonna have dry mouth. Why? Yeah, I need Tic Tacs. I remember sneaking Tic Tacs, but I remember sitting next to you, and I felt a bit like I was a commentator because it was just well, and
It was totally like
I think I think it's it's not even really about politics though. It's about justice.
that.
And
Yes. Yeah.
I remember I'll never, as long as I live, forget that moment, Anne Marie, that we sat in the Senate gallery last June.
Hmm.
Again,
Yeah.
it was the Right to IVF Act. It was a bill that was introduced by Senators Tammy Duckworth, Cory Booker, Patty Murray.
Mhm.
They're all three huge champions for IVF, for mandated coverage, for all of the
Mhm.
things that we fight for. And so it was a pretty watershed moment for both of us to be just kind of
It
sitting in
was.
this Senate gallery. And I remember having this just sadness come over me because
Mhm.
we knew going in that that was not going to pass.
Yeah,
Unfortunately,
but
we knew,
we
but there
knew,
was
but there was always that hope that
there
like you're like,
was there was this
oh,
hope, and
yeah.
as soon as it because I'm a bit of an eternal optimist, and so I think I just was like maybe, and so I remember it dawning on me when I saw, frankly, a bunch of older white men um, whispering over here in the corner, and all
Mhm.
of a sudden you're seeing folks that you like. For me, I knew all these guys on TV, and
Mhm.
all of a sudden I'm like, there, Lindsey Graham and Mitch McConnell and Ted Cruz and Marco Rubio are all whispering over here, making
Mhm.
decisions for how I can live my life, how I can build my family. Something's
Mhm.
not right with this, right? Like,
Yeah.
and the people and for me it's about, like you said, fair is fair. So you've got to
Mhm.
make sure that the people writing the laws actually understand the lives they're legislating. And I had become really passionate about that working in the hospital because I would see these like senior executives who had never touched a patient their entire life
Mhm.
making these policies, these rules, these things that made no sense in the
Mhm.
grand scheme of things, right? You can remember that people are like, okay, for now
Yeah.
we're going to do report by doing blah blah blah, and you're like, okay,
Yeah.
have you never worked with a patient? That's not going to work.
Yeah.
And so yeah, at the end of the day, I think taking that leap into advocacy a little bit more on a one-to-one level, right, which is what you and I had been doing as nurses, advocating
Mhm.
for our patients case by case, and then amplifying that up to the policy level for more than just that singular patient. So I think you and I recognize these systemic failures, and we said, let's make sure that the people writing the laws understand the lives they're legislating. Because, for example, most folks that I had conversations with pre Roe v. Wade being overturned, aka the Dobbs decision, would vehemently disagree with the fact that fetal personhood was going to become a problem, right? So
Yeah.
we have a history of legislating pregnancies in this country based on religious ideology. We just do.
Mhm.
And I deeply believe in every single American's right to practice whatever religion they want or none at all. It's written into the words of the Constitution. So
Yeah.
for me,
Absolutely.
I was like, everybody's using a religious definition of conception instead of just the scientific definition. And
Yep.
now that's how we ended up with Alabama. And all of a
Yep.
sudden, embryos are people and blah, blah, blah. So
Mhm.
kind of mind blowing, right?
It was very mind blowing because that whole Alabama decision came at the beginning of our advocacy.
It
It
did.
happened, I think, in what, February of 2024?
Something like that. Yeah. And we
Yeah.
had started our
And
primed program. So, again, for
yeah,
those
and it
watching,
was just like it just took off. It was crazy how much that took off because it was just like, wait, what? And then all of a sudden, IVF became like the front page news, which was
yeah,
good. okay, it's good that it was in the news because we need to address it, but at the same time, it wasn't really why we wanted it to be in the news. But
No, I know, right? That's interesting
Mhm.
too, because IVF, I mean, I think for a good like 8, 10 years, we were just kind of all doing our thing, right? And then all of a
Mhm.
sudden, it got thrust into the national spotlight, which, as you
Yeah,
said, it is a good thing because at the end of the day, I think folks really did not, there was way too much stigma. People were suffering in
Mhm.
silence with their
Yep,
infertility, with the grief of not being able to afford their cycles, their meds, right? Because that's embarrassing to have to. For one, it's if it's already a little stigmatized, and then you have to say to your friends, "Yeah, I can't do that because I can't afford it. I don't have enough money," right? So what that
yeah,
just the reality of that was is so many people were suffering in silence, and you and I were remember we were advocating for infertility before though before the primed program. So
hmm
you and I were really lucky because we were chosen as the inaugural cohort of this program. There were
yeah,
12 of us, and you and I were one of them. We're
yeah,
two of those people, and it was so humbling because I remember thinking like, yes, like I want to use my voice to amplify this message, to uplift this message, to help folks understand what their friends, their sisters, their neighbors, their nieces are going through. And
yeah,
it, again, making sure that the people making the laws understand what the actual, true, real impact is of those decisions, right? So,
yeah,
yeah, so I mean, that's why we're here. That's why the
yeah.
reprofiles exists.
Absolutely. And we're not here to tell people what to think. We're here to help people, ask better questions,
Yeah.
and educate. Not just like, oh, this is what IVF is, but hey, let's look at the greater context of it, legislatively and everything.
Well, yeah, and I think that, it's making the invisible visible, right? To shine a light
Mhm.
on the injustices that do hide behind these sterile waiting rooms and these state house doors. And my own personal healthcare journey of, having an invisible illness, I think really set me up for this time in my life, right? Because I truly understand it on a deep level. I mean, I've been the victim of, prescription drug injury, of the surgical accident times two. So I've really been on the patient side of things, um, and to me it became something that having a family to me is a fundamental human right, right? Like,
Yeah. Yeah.
and to bring class into it, to bring money into it, that always felt so unfair, especially to me because I did grow up in poverty. I watched my family struggle to make ends meet, working, you shouldn't have to work two jobs. And well, let's expand this too a little bit because I think those of you watching, like, we want you to understand that this the Reprofiles podcast is about a lot more than reproductive health and justice.
Mhm.
It's all the things that nobody told us about, right? Perimenopause.
Mhm.
Why didn't anybody tell us about this, Anne Marie? Why didn't anybody warn us childbirth was as horrible as it is? Like, I mean, I think we can all give examples of things. It's like, why didn't anybody tell us? But you and
Tell
I
me this.
have started really putting the pieces together and seeing the impacts of things like the Dobbs decision, of things like
Mhm.
um, the legislation that we're seeing now. That's
Mhm.
further and further seeking to control uh, someone's autonomy rather than allow them to have the right to do what they see fit. And that's where you will all find with as you listen to us is there's this big intersection that reproductive health is very much the foundation of, because our reproductive autonomy is what makes us human, right? If we don't
Absolutely.
have babies, there's no society.
Yeah.
So to control that, I think it really calls into question all of the other fundamental freedoms that we have. One that is, your zip code, your mean household income, in my mind, should not determine whether or not you can see a doctor, whether or not you have a place to lay your head down at night, right? These are not radical views. They have been highlighted as such by those who would like you to believe that they're radical, but they're really not. It's not really a radical idea to think that folks should have the right to make a decision over their own body, right?
Exactly. Yeah. Yeah. So, you know, we hope that everybody listening will stick with us because this is going to be real. It's going to be raw, sometimes a little ridiculous,
Probably
but
a lot.
always, yeah, but always rooted in truth.
Yep.
And we're going to talk about fertility,
Check.
sex education.
Uh-oh. Check.
Yeah. Uh-oh. Ooh. Maternal and fetal health.
Also check.
Uh,
What else?
Factors affecting the LGBTQ community.
Yes. Huge,
Mm,
huge, huge, huge. Oh my
huge.
gosh. I could not
Yeah.
believe when I got into IVF that all of the consent said husband and wife.
Oh yeah.
I was like,
The
what? We'll get to that later. But I was like, oh my
partner
gosh,
only came like
let's,
past couple years, but
yeah.
yeah. So we're gonna talk about that menopause thing.
Ooh, check. Love that
Yeah.
one.
And I know we're talking a lot about women folk, but it's also about our men folk too.
Yep. Check.
So basically everything reproduction.
Yes.
So also at the end of all of our episodes, we are going to have a call to action. And in this week's call to action, we have two asks. Number one, come back and listen to
Ooh,
us.
yes. Come back and listen
Yeah.
to us. We promise we'll be,
And number
we're going to be getting into some pretty juicy topics. This week
yes,
is really just all about kind of setting the stage, getting to know us a little bit, but we're going to delve into all the stuff that nobody told you about. So ask one,
absolutely.
come back and listen. What's ask two?
Yeah. Number two, find out who your House representatives and your senators are. I
Yes.
didn't know who mine were until Elizabeth taught me that I should know because she knows all 100 senators, by the way. I
I
do not.
wish,
I
but
know
close
two
maybe.
because I live now in a state and I know my two. Of course, I have fangirl senators that I
I know
have,
you adore
like
my
in
Senator
Arizona,
Mark Kelly. He's
Mark
amazing. We're
Kelly.
so lucky.
Yeah.
Is your senator an
But okay,
astronaut?
so
I don't think so. I'm just saying. Is your senator an astronaut? No, he's not.
no.
But
But I
I
do.
think I think you're. I love this because so many involved, educated, engaged people still don't know who their reps are, right? Because there was a time
Exactly.
when you and I were growing up in politics, or growing up, you didn't see the like fixation and the constant magnification of every detail of politics, right? You didn't
Yeah.
see like I feel like now it's like it's like a reality TV show almost, right? Like everybody's got their
Yeah.
hair and makeup and their cameras. I mean, we've never seen cabinet members be like, like on
On social
camera
media.
all the time. Like, no, like
Yeah.
go do your job. And
Yeah.
then, right. So I think, we're going to talk about all kinds of things that matter. Next week, we're going to dive into the BBB. And we ain't talking about the Better Business Bureau. And we also ain't talking
Oh,
about a Brazilian butt lift. That's
oh.
right. I know, disappointing. We're jumping into the big, beautiful bill. Okay. And why? Because the big, beautiful bill, as it's called, is the largest transfer of wealth from the poor people in this country to the rich people in this country. And it's going to be done through controlling access to healthcare. And we want to bring in the data, we want to bring in the facts, how it's affecting how we're going to practice healthcare. A lot of people that I talk to say, Elizabeth, politicians always claim they're coming for our Social Security, they're coming for our health care. This is a talking point, but I think so many people don't realize that this has gone beyond a talking
Mhm.
point. This is now legislation that has passed and is going to be systematically undoing the healthcare the way we know it. Who will have the privilege to be served? What will be all the other downstream effects of the bill, right? I think that our role will be hoping and trying to educate everybody just on the facts, right? Is separating the partisan gutter
Yeah.
brawling from just what the facts of a situation are and helping folks to understand how something is going to affect them directly, right? And so, and then we also want to include, next week, we'll be talking a little bit about the executive order that was issued on IVF. If those of you, who paid attention to the election cycle, there was a lot of promises made about IVF becoming covered for everybody, paid for by the government, all of these things,
For
and
their insurance.
or their insurance. Yep. And
Yeah.
and that order was written in February from the so-called father of IVF, if you all recall.
Mhm.
And I hate to say this, but that preyed upon infertility patients' hopes and dreams. And so we're going to talk next week about how that order has basically now just been shoved in a closet all the way to the
Mhm.
corner, never to see
Yep.
the light of day again, and essentially
Nope.
was just used as an empty campaign promise. And that breaks my heart because you and I both know that there were probably thousands, if not hundreds of thousands. Infertility is a 1 in 6 issue. It affects men and women equally, right? So to think of all of the people who saw that campaign promise, who saw that executive order and thought, oh my gosh, we're going to have a shot. And to just shove it off in the corner to me
Mm.
is shameful. And so next week, we'll talk more about the big, beautiful bill, what the implications are. We're going to bring you data, we're going to bring you facts, we're going to try to help you understand it on a level of how this is going to affect your everyday life. So,
Yep.
yeah,
So let's pull back that curtain.
yeah,
Let's talk about infertility, injustice, and all the things nobody warned you about.
that's right,
So
friends.
welcome to the Repro Files.
Welcome to the Repro Files. Thank you all for listening or watching. It's not an easy thing to start a podcast. Anne Marie and I have been thinking about this for a very long time and doing a lot of planning. And we're really excited to bring you all kinds of topics. And so, like this podcast, share it, tell your friends, come back next week. But we really appreciate that you spent this time with us. And we look forward to bringing you all those things nobody warned you about next week. Bye bye.
Thank you. Bye.